Okay, Jeff said he's gonna call in. Oh, he's already called in.
Or he was on there.
Yep, I'm here. Can you see me? There we go. Okay, whenever we're ready to rock and roll.
It's up to you. 6 o'clock. You're the boss.
Okay, it's 6 o'clock. We're having the April 18th, 2024 meeting for the Platte County Health Center. Let's do opening roll call. I'm Dr. Kingsley. Who's all here?
Susan Cole here.
Kim Swaney here.
Michael Chaffee here. Zach Greineke.
Okay. Very good. Let's stand up, do the Pledge of Allegiance. All right, I pledge allegiance to the flag of the United States of America. For God, indivisible, with liberty and justice for all. Very good. All right, now is introduction of any guests and public attendees.
So the one guest we have is actually on the agenda, but Jared Pruitt, our county clerk, is here to share some important business here in a second.
Okay. Is that it for public attendees? That's everybody?
Yes.
Okay, so I guess we need to do election of new board members, and I'll let Andrew take over to run that part of the section.
Well, hold on.
Would it be best if we went ahead and had our new board members sworn in?
Yes.
Oh, yes. Yes. That would be ideal.
Are we
Okay. So,
ostracizing him out
go
of the
ahead and take
office?
over. Thank you.
Sure, we put it off to the end. I mean,
Well, Jared told me she's leaving after he gets sworn in, so it would be kind of mean to do to her. Like, we're gonna put you at the end.
but that's what you said to do.
Shh,
All right.
don't throw me under the bus.
If you'll just raise your right hand, please,
I'll
and
stand.
state your name,
Zach Greineke.
and do you solemnly affirm that you will support the Constitution of the United States and the Constitution of the State of Missouri, and that you will faithfully perform the responsibilities as a member of the Platte County Health Department Board for which you were elected on April 2nd of 2024?
I do so swear.
Okay, perfect. I'll sign this and then I'll bring it up to you. Have to sign.
And if you don't mind, Zach, we'd like to get a copy.
Yeah.
Cindy, can you make a copy?
Thank you.
Thank you all.
Okay.
So for full disclosure, Dr. Kingsley already got sworn in, so he
Right.
did that before he left out of town. So
Yeah,
I
I
have,
was going to be out of town, and then Jared wasn't actually in, but I was able to get her deputy staff who were awesome
Sure.
to take care of it.
okay,
Are we good?
we're good.
All right. Congratulations, Zach.
Yes, same to you.
Okay. All right. Now we can let Andrew run the show. This part of it to do his thing.
So I think really the next thing is the Board of Trustees officer election. So every year in April, we go through the process of electing board members. So we are always going to have a chair, a vice chair, a secretary, and a treasurer. And then the last position is the board member. And this is actually, I think most of you know this, this is actually the officers as delineated in state statute. This is what every board of health center trustees is required to have. So I guess nominations for a slate. Dr. Kingsley, did you have a slate that you wanted to propose?
After talking to everybody, except for Zach, everybody said they wanted to continue doing everything that they were, the positions they were already holding. So if we want to do that slate, and then Zach would be the general member, I'm fine with that. Anybody else have any ideas or thoughts or recommendations? I'm totally open to do whatever you got to do.
I spoke to Jeff today and I feel like we have such a great working group, and while the state is a requirement for us to have this, I think everybody ought to feel comfortable in their roles, and I don't think
We're
we
just
have
kind of
any.
learning some things right now. To be
Right.
taken off would be a little
Yeah,
mind boggling. Are you okay
Yeah.
with the position?
Yeah, no, I know when we met with the DHS that previous meeting, that was one of the things Dr. Kingsley and I talked about as well. Just that I think it's good for me to fill into the member spot, so I get my bearings, figure out what's going on, where my interests lie within the things we're doing here as well.
The other thing too is my ego is not so big. If somebody else wants to be chair, I'm totally cool with that.
somebody with a big
So-
ego has to say that.
Oh, okay, okay.
I got you. Love you, man.
Okay, so then I guess, do we have a motion for how we want to do the new officer rankings or whatever? Anybody want to make that motion?
I would just make a motion that all current officers retain their current positions,
And Zach,
and Zach as general member.
board.
Is there a second?
I'll second that.
Any further discussion? Going once, going twice? All in favor, say aye. Aye. Any opposed? No. Okay, so general consensus, everybody's in agreement.
Yes.
Yes,
Yeah.
Okay, and the other thing too is Zach, even though you're quote a general member, we do have subcommittees that need chairs. And so if there's something you really have a passion about, make sure you voice what you need to do and start taking over leadership for subcommittees or whatever you need to do, okay?
That's good.
And we
Okay.
will be discussing those board meetings and or those subcommittee meetings here, so you'll have exposure and be able to think, oh, I want to do that, or, you know, I really like Susan the most, so I want to be on whatever committee she's on.
Right. Okay, I guess the next thing then, now that we got our officers, is go over the past minutes. Has everybody had a chance to look at those minutes?
Yes.
Yes.
Anybody have any concerns, any changes, anything that they've seen?
I make a motion to accept the minutes.
We have a second?
Second that.
Okay, any further discussion? Okay, now I'll do the full, we'll do one at a time then. I'm a yes. Mike,
Yes.
Susan,
Susan, yes.
Kim,
Yes.
and then Zach?
Yes.
Okay, all in consensus there. Okay, let's move on. Okay, Andrew, I'll let you run this part going forward. Do your thing.
All right, so old business, the Swope Health Services Family Health Care Clinic contract and update. We don't have a lot to report here, but we do have some to report. So we have drafted a contract. Our attorneys looked at it. We also created a lease to accompany that. We talked about that at the last meeting. So both of those have been approved by our attorney and they've been sent to Swope. Last week, Dan, Dustin, and I met with Jaron Raven and Namish Patel, who is their CFO. So Jaron is their CEO. So we met with the two of them, and it was really more of just kind of a, we never really met each other, so it's just kind of a get to know you type of thing. We had lunch, did a tour. It was a pretty good meeting. Namish is really together, and I think you had expressed them. I don't know, their numbers just seemed to look right and seemed to be appropriate. I think he's the one behind all those numbers, and he was fully aware of what they would be able to do and that type of thing. You know, we didn't get into any details, but it was a great meeting, I thought. And it was not very substantive, like I said. It was more just kind of get to know you. Dan has to ask the questions to make it serious. And his question was, so when do you think you would start? And it was probably the best question asked because I really wanted to know the answer. And they seemed to think, and now we talked about it afterwards, but they said they hope to be in place August 1st, running the clinic. That is going to have some variables in it. It could possibly be sooner. I did not get the impression that Jaron thought it would be any later. Just getting to know him, he seemed like a under promise, over deliver type of guy, which I like those people. So Dan, was that your impression?
It was, yeah, that's kind of.
And so I want to clarify, so August 1st is when they expect to be in the building, or August 1st is when they start seeing patients?
Patients,
Actually having patients that they're saying, okay, excellent, all right.
which there's a lot to do between now and then. But they have already submitted the paperwork, I guess, to HRSA that they needed to start the ball rolling. So they've submitted that. So they are working on, I mean, I got the impression there's lots of balls in there, but they weren't going to say when they were going to land. Is that,
Yeah.
Dustin, Dan?
Yeah.
Anything else you guys want to add about that meeting?
No, I mean, I think they were, both very personal people. We hit it off well, I think. I think it's gonna be a great relationship, great partnership. So,
I agree. They've been very eager. They're very impressed with the building. They love how great it looks and like everything's pretty new and love the location. So I think it's going to be a really good benefit for our residents and people who come here for those services.
And I didn't think it was quite fair to put them on the spot quite yet, but do expect them to be coming to a board meeting at some point to just kind of, as they get a little bit further along and have a little bit more in their plans. So they can, because I know you all will probably have questions. And so we did advise them that they'd be invited to come speak about how that will roll out. And I know Dr. Jamal, who you met, has been in touch with Dustin and Janice and Dr. Parker, all on our team, to start talking about the messaging and when we plan to start letting patients know you need to start getting ready for this transition and what you need to do and all those types of things.
Has there been more discussion about integrating the two employees or how is that going?
They're very excited to talk to her.
Mhm.
So it's really at this point just one staff member.
Okay,
So
all right,
it's
that's right.
Janice.
Okay, Janice, okay.
But I think they are excited about the possibility. Janice, I can't speak for her, I think is very interested in hearing more about it.
Mhm.
But I do think it has to be a good fit for everybody.
Sure.
So they are definitely want to do it. I think Dustin or Dan said something and they said, Namish actually said, well, that'd be great for continuity of care and people being able, I think we've all said those same things. So I think that is definitely on the table. Okay. Any questions? I'm sorry, it's not a whole lot there, but it's kind of, until we get the contract and some of the nitty gritty stuff, then we'll actually bring our selection committee back together to discuss some of those things. But right now it's just, I don't know that there was anything definite. Would you say that's accurate?
it's accurate, yeah.
I think hurry up and wait is what I've been telling our staff members when I ask about it. It's kind of where we're.
Because some of our staff would like to know, what's the date, when's, what's this mean and what's this going to look like and what number do they call and all this, and some of those things just aren't here yet. So if there's no questions on that, I'll go ahead and move on to the next topic.
Actually, I do have one, Andrew, I do have one question. So what did they think about our proposals for the actual rent? Were they happy with that?
Very appreciative. Yeah, they did.
Imagine that.
They did express how much they appreciated that willingness to help them succeed.
Okay, excellent.
So I took some leadership training very early in my career through Brian Joyner, and they had things that were like just subpar and then meets expectations and then just what you expect of a good customer service and then things that you don't expect. And they called them delighters. And I really got the impression from them that was a delighter for them, that they really felt like, you know, granted, it's a significant amount of money, but it's not tons of money to their organization. But I got the impression they really felt like that was a sign from us that we were trying to work with them. So I think they were very appreciative of the board's direction on that.
Excellent.
Anything else, Dr. Kingsley?
No, that's it. Keep it rolling.
So we had talked last month about the National Association of Local Boards of Health, and we are a member, and I found out, I don't think it's in here. But there's actually like about 15 health departments throughout the state of Missouri that are members of NALVO. So we met with Tiffany Bear, who did our board training. We met with Michelle Morris, who's the chair of the Missouri Association of Local Public Health Agencies, who at one point hosted NALVO, which is the Missouri Association, so the national affiliate for Missouri, and just talked to them about what getting Missouri's act together would look like. Tiffany wanted to, she was very excited about the whole thing, but she is in the process of reaching out to probably what she said, like 5 or 6 different board members from across the state. So we can kind of have our folks who want to be involved. And I know I've either volunteered you or you kind of volunteered yourself, Dr. Chape.
No, I'm enthusiastic about participating in the exploratory process and helping them figure out what they need to do to make us more effective in what we're doing.
And I know Dr. Kingsley has expressed some interest too. So
I'm on board.
So basically what she wants to do is have a preliminary meeting with board members from across the state to talk about how we can do this and get people in each of our regions on board so we can do it statewide. So I organized the meeting, but she asked that we give her some room and time to work. So that's what we're doing. She said she'd probably get back with me in the next month or so. And we met last week. Were you not on that meeting? Okay. Dan was,
I was there.
Taylor was there. I get them too confused. Go ahead, Dr.
No, go ahead and say what you need to say, and then I'll jump in.
Taylor, do you remember? She said like in a month, right?
Yeah, I think so.
Go ahead, Dr. Kingsley.
So I just wanted you to kind of clarify. So you said how many different states are part of NALVO? You said 15 states?
No, go ahead.
15 other health departments in the state of Missouri.
The Missouri of it. And then how many
Now,
states are involved?
NALVO.
Yeah. And then how many actual states are involved in this?
I think there's someone from just about every state. I won't promise.
Everybody, okay. So every state except Missouri, obviously. So, okay.
Well, but we're members, so there's members from every state. Not every state has an active affiliate or chapter.
Got it. Okay.
International meeting is coming up here in May. Is that right? I got an email.
Yes.
Yeah.
Has there been any indication that it would be beneficial for anyone on the board to go to that?
If anyone would like to go, we can make that happen. If that's really up to you, it's kind of.
I'll follow up on an email to you, but also we'll see how things work out. At some point, it would be for a Missouri chapter. I don't know if it's good to have a brief meeting at the national meeting or something, but.
So every September, there are multiple, so the Department of Health and Senior Services the Missouri Center for Public Health Excellence, the Missouri Public Health Association, and the Missouri Association of Local Public Health Agencies has a joint conference in Columbia. So the thought would be is that at least for this year, for sure, if we're going to start this Malbo process, we have a meeting there for Malbo people. Now, going to the national conference for NALBO and being able to interact and talk to others about how they are doing things, I think would be very valuable. So if you're interested, or if anyone from the board is interested, we can make that happen.
If I'm free and somebody else wants to go, I'll go.
I think it's mid-May.
Mid-May, okay. I think it would be interesting to hear kind of what's on their agendas and see what issues that they're concerned about. Because we're actually starting out cold. They're already, knee deep in it. It would be just interesting to see where they're at in the grand scheme of things.
The impression I got more than anything is if we have a Missouri chapter, it would be a resource to other smaller or to all health boards to have a resource and to feel like they're part of a Missouri chapter to where they feel like they can participate, get assistance, or provide assistance. I think all of those things are good for the people who are already ahead of others. We got to help them out, and the other folks who think they're doing it right can bounce ideas off of them. So I think some of that will get laid out, but at the national, it might be an opportunity to talk with state chapters and look at their bylaws, what their purpose is, what they've been successful at, what they want to do but can't do it. And that's the only reason that I thought it would be beneficial. I think I'd like to for sure check my schedule and make sure I could make that, check with my boss and get permission.
Right. Like I said, though, it would be interesting to see what their concerns are.
Yes, you do.
Right? It would be interesting to hear what their concerns. Like I said, they're knee deep in it. Because that was one of the questions I had about the initial start process is why did the Missouri chapter fall apart? What were the issues that they were dealing with? And then what are the issues they're dealing with at a national level too? It would be very informative, I think, to go.
Cindy Kogan and I will get the information together and get it to the entire board. But I'm kind of hearing right now, Dr. Chaffee and Dr. Kingsley are the ones who are kind of interested in going. And that kind of makes it easy because then they can go and not worry about any board business being discussed like it shouldn't be.
But that's reasonable. And from our meeting on the 21st of March, the benefits to chapter were local resource for collaboration, central repository bylaws and programs, and encourage and support accreditation.
And I think at a national level, you'll find those are pretty common. Like I haven't been to their conference, but my guess is that's pretty on track with their things they support too. So we will work on that. Any more questions about that? Go ahead, scroll down. So this will look different probably in about 4 or 5 months, but right at the moment, we are still kind of chugging along about where we've been. If you can scroll down just a little bit. If you look at the table where we were over March 21st or March of 21 and 22 and 23 for uninsured 51, 40, 45, 43, not a whole lot of variance over in March over the past 4 years. I did get an interesting call from Karen Dolt, who is with Northland Healthcare Access, and she was particularly concerned about where we are with the transition and what that meant for, in particular, Tricia Rothweiler, who is our their official title, social
Education, yeah.
Well, she's still getting paid. Half of her salary is getting paid from Northland Healthcare Access. to connect clients that are seen in the family health care clinic with services. So she was asking, are you using that money for something else? And I thought we had had the conversation, but I just reiterated, no, Tricia is actually has kind of 2 full-time jobs for right now. So August 1st can't really happen fast enough for her, but she is doing half her time in the clinic and half her time over in health education. Similarly, Don Padre, who is our public health paramedic, who's working in the clinic, is also has a job as our emergency or preparedness planner, and so has 2 full-time jobs as well. And so once Swope takes over, they will full-time transition, but they are juggling what they can. And so I kind of explained all that to Karen, and she thought the numbers had drastically went down. So I shared these numbers again with her, and I think everything was fine. For some reason, there was a misunderstanding. Go ahead and scroll down.
Just to backtrack, I was mistaken on the NALVO conference. It's August 12th to the 14th.
Okay, good. We have a little more time to
Yeah.
prepare for that. Where's it at?
Nashville.
We better not see the 2 of you on social media.
That's
I'm
right.
gonna say Nashville is a pretty awesome place to be.
The reservation deadline is the 19th, at least on lodging.
Of this month or May?
July 19th for lodging. We're like block rooms.
Okay.
I guess I'll ask this. Are you 2 good going just together, or did you want any staff to join? Or do you want to?
There's the benefit to the staff being there. I'm not going to stand in the way of it, but I'm mostly going to get a vibe and a feel for it and a flavor and see how it can better help the citizens of Platte County and the state of Missouri.
So I'm pretty comfortable with you 2 just bringing back the information. I just didn't know if you wanted like Dan or me or any of us to go, just so we know when you're talking about stuff, kind of what you had heard. But we can discuss that offline too.
If you want to go take notes for me, I'm fine.
Well,
I'm kidding.
I don't. I would send Dustin for that.
That's like right before back to school. That's like right in that.
You aren't doing
Oh,
anything.
excuses.
I mean,
Taylor,
I'll complain to get away from that, but if you're having a lot of angry nurses, I'm pointing towards your door.
so Taylor loves 2 things: note taking and traveling. So, but we can talk more about that. Go ahead. So I think last month I talked about harvesters. There's our parking lot looks like it might have some kind of rash because there's white circles all through the parking lot. And what those actually are places where we put our cones for traffic control. And basically what that's helping us do is get us really speedy and setting up for any kind of distribution. Of course, every month we're doing the harvester food distribution, but really that is just a drill for if we are doing something else public health related. I think it's we're getting better at it and faster at it every month. And people are getting comfortable talking on the 2-way radios, doing some leadership and organizing things that typically they would not be doing. So I'd love to see that. And getting a little bossier with like just being more confident and comfortable with traffic control and that type of thing. Our first 2 events, which were January and February, I was concerned, and I think Dan was concerned. We had traffic way out onto 110th Street and down the block, and it's no parking out there, and they're blocking the road because people were showing up at like 11 o'clock for this 1 o'clock event. And so the staff kind of worked together to do some brainstorming and see how we could get traffic staged a little better. And the past 2 months, no cars were out on 110th Street.
So Andrew, I have a question about that. So you said you went to the Air World meeting or whatever, and they didn't really express any concern about the parking on the street or anything. But so if we do harvesters on a weekend, would that make any difference if it's not a business day? Or we just don't have the staffing to do it on a weekend?
We probably would struggle with getting staffing for the weekend, but it's not going to change much of the fact that we would still be blocking a street that shouldn't be blocked.
Right, but Air World hasn't complained so far, but I think it's wise that you keep doing what you're doing, trying to open up as much space on the actual health department grounds for the parking. I think that would be, at least through the drive-through part of it anyway. So yeah, but it's nice that nobody's complained about it from Air World, so that's good.
Well, I'm concerned about the police actually coming.
Those streets are not marked as no parking.
They are.
They are marked as no parking, but these people are waiting in a queue.
Right, it'd be like at the airport, you're waiting for something.
Flu shot clinic, that if they're not parked, but they're waiting for a queue, I can't imagine that there would be any citations provided. If there's
Imagine the
it's
public
problem,
relations disaster.
he
If
would
you
be
did that.
made aware that it's a problem and then we have to fix it.
Right.
Would they assign a police officer to direct traffic?
If we applied for it
Hmm.
and got permission, but it is a public street. And it's something that we're trying to do monthly. And it's just, that is not really, there's a lot of things you have to do to get that to happen. And also pay for that.
But
So
imagine the public relations disaster if you try to give citations out for people trying to get needy people that need food. That would look horrible. That'd be front page on the Kansas
Wouldn't
City
anticipate
Star.
that would happen. I guess it's not a problem until it's a problem.
well, and I think the other thing is, and I've spoken to the board, we have neighbors that, we are trying to not have any friction with, and so we're trying to be good neighbors, and they have entrances on 110th, so we're just trying to not pose a problem. So if we can continue to do what we've done the past 2 months, I'm not concerned at all. Are you, Dan? Yep. The other thing, just for our vital records, so birth and death certificates and death certificates, every day it seems like we're getting more and more folks who have realized where we are. We get to see a lot of cute little babies come in to get their first birth certificate. Mm-hmm. That's always fun. Kind of really a joyful thing to see every day. You can go ahead and scroll down. We are rapidly approaching our 1-year anniversary for being in the building. I think most everyone knows that for our HVAC issues, our warranty is extended quite, I think it's like September. But a lot of the other things, our warranty stuff is going to be up on May 1st. So we are working very hard to make sure we are checking off, and we've done multiple walks through to check on stuff that needs to be warranted. We have another call today talking about it, but we want to make sure we get everything fixed that we can. We had an interesting meeting yesterday, thanks to one of Cindy's staff. Her name is Alana. She has been doing some research. She actually works at our front desk, but she's been doing some research on building management software. So it basically, you put in, like, we have to change filters or check filters up in the RTUs on different schedules. And so all this building management software does is, like, one of the things our building, what's his title? What's Frank's title?
Maintenance technician.
Maintenance technician does is every morning when he's here, his first thing is to police the grounds and pick up trash and limbs and kind of take care of that. So basically the software provides all of his to-do lists and it always keeps track of everything. It looked really promising. I think it is about $17 or $19 a month per user. And the user is someone who can go in and assign stuff and delete things. So it's really an administrator, but everyone can submit requests. So Dustin wants my picture hung on his wall in his office.
Motivates me, just have him staring down at me at all times.
He can put that in and anyone can put in a work request. And then it goes to Alana and she would act as our person who says, yeah, we're not having any more pictures of Andrew and denies it and sends him back a note. She demoed
Yeah, that's
it.
very handy.
It was a great demonstration. She did a really nice job. She's one of our newer staff and she's one of our kind of entry level staff that mainly works at our front desk. But I loved that this kind of thing was given to her to see what she could do with it, and she did a very nice job.
Yeah, it's very, very user friendly. It provides a place where we put all of our building assets, all, each individual RTU, the phone, the telecommunications network, on and on, but all the building, the generator, all the building assets, and also all the vendors that we use. So I just kind of puts everything in one place.
Now, I may sound like I'm acting pretty excited about it, not nearly as excited as Dan, because like all the vendors are already in there, like tons of the stuff. He has their website, their phone numbers. And so when I said I don't want it in that field yesterday, he almost hit me with a baseball bat, but he didn't. So that was good. But it's really going to be promising, I think.
Yeah.
And she's excited. I think Frank is concerned about how it will work, but I think once he gets used to seeing that it's checkoffs every day, and then I think one of the important things is then we are really doing a good job of accountability too, because we will know absolutely every day what is being done, the things that aren't being done, what we don't have enough time for. So that will really help us be accountable and improve our flow. Anything to add on that, Dan? For the budget, we are.
Actually, Andrew, can I jump back in?
Sure.
Can we go back up to number 4? I'm just curious. So for the COVID-19 numbers, how long are we required, or how long do you want to keep doing track of this? What do we actually do with those numbers at this point?
We're not doing a lot with it. Taylor, do you want to talk about that?
I mean, we're posting them on our website, kind of just tracking them just to see how they compare to previous years. I don't think that we've had any direction about whether we need to keep them or not.
You might want to talk to Aaron. Can we get back with you, Dr. Kingsley? Because Aaron
if we're required to keep the numbers, I have no problem. But if we're just doing it just to do it, I'm sure we could do something else with that time. But it's up to how you guys want to play this out, I suppose. But I was just curious where we're going with that.
It's still getting reported to us and we're required to pass it on. We're not required to put it on the website.
Okay.
We'll get back with you.
Okay, that's fine.
And we probably, if it's okay with the board, I'll just have Taylor get with her team and we'll just address this issue next month. So we'll either address it with it still there and explain why, or it won't be there and we'll talk about why it's not there.
Okay, that's fine with me.
Or, so to the budget, we're a quarter through the year because 3 into 12 is a quarter. Dan taught me that math. So for our revenue, we are at 2,940,387, or 67.8% of our total revenue budget. And Zach, some of these things I'll just kind of, they probably heard me say this 8 million times. You haven't, fortunately for you. But we get most of our revenue from the mill tax. So we collect that at the beginning of the year and at the end of the year. So we're at 67.8% of our total revenue number, which means the rest will most likely, we'll have some grants and stuff throughout the year, but largely it will be the mill tax at the end of the year that will complete our revenue projection.
So Andrew, could you explain? So they allot out the mill tax by, like, they give you 50-50 kind of? How do they actually break down what you get depending on what part of the year it is?
It's just as it comes in.
So as you get it from the county, you just throw it. Okay, but so why is it? I understand at the beginning of the year, but why at the end of the year?
Because then people are paying for next year's.
So those are
And
early
And
tax.
some people's taxes aren't necessarily, it's a real estate tax, so it has to
Yeah.
be paid on time. It's not, it doesn't matter if you're filing federal late. So this is a property tax issue. It
So-
gets paid.
If you have a mortgage, you know, almost every lender takes that escrow and pays pretty much that last week. I mean, that's when they're going to pay. So we have certain people that are going to pay it earlier or whatever, or we won't collect all of December. That's actually why we get that 67.8% at the beginning of the year. It's stuff that was collected in December, but we're not getting it till January. Does that make sense?
Yeah.
And then the other 32.2 or 32.2% are paying in November and October. But that's why it's split like that. The county is just giving it to us as they get it.
Okay.
So for expenditures, generally, you know, beginning of the year for us, mid-year in July, and at the end of the year, we have certain bills that are due. But for the most part, our expenditures kind of follow along. So we are at 23.3% of our expenditure budget. We are a human resource intensive organization. So payroll is, what is it, like 68.9% of our expenditures. So really, it reflects that people have gotten paid a quarter of their salary, and that's about what we would expect. As far as how we would compare to previous years, 2023, and I know we've discussed this at length, but we were moving into this building and we elected to take about $500,000 and put it out of our reserves at the time. I use that term loosely, but we elected to pay for a lot of stuff instead of putting it onto our loan. And it saved, we had a loan for $5 million and we only used $4.5 million of it, but we used our real-time money. That kind of put us a little bit behind on our money market balance, but as you can see, we bounced back fairly nicely. We are at $2,759,816, where last year at the same time we were at $2,670,085. So I think that was the right call. We did not meet with the finance committee. Sorry if I'm stealing your thunder. But we do have a plan for our reserves, but we need to finalize that plan.
Yeah.
And it's not going to change much of what we do right now. So I felt like it was fine Susan and I kind of chatted back and forth. But one of the things we'll be doing moving forward is some of this reporting will look a little bit different. We'll have a dedicated building reserve account, a dedicated operational reserve account, and we're going to be able to know what these things are earmarked for instead of having, every time I look at this table, it seems to me where it just kind of looks like, oh, they have a lot of money. Why are they just hoarding money for no reason? And you know, you never want to be so paycheck to paycheck, because if that emergency happens, you have nothing to rely on. So the reserve accounting will be very helpful for us, I think.
So when we break it up into the different accounts or what, are we still going to get the 4.72% or better rate, or what happens with that?
Well, that was one of the questions that the board asked us to check into last month, and the answer is yes. I don't think Susan knew the answer to that, but the answer is yes. So it's going to have zero impact. It will be, they're basically looking at it as all of our deposit accounts as a whole, rather than individual accounts, so they all credit to us. So it won't have any impact there. Good. And because we'll be building those balances up for the, you know, for a while, it will actually help us in the long run. Did you have a question, Dr. Shelton?
No, just Jeff, it's about 63% of the cash reserves, just for everybody's knowledge, that other county entities do keep cash reserves, and maybe sometimes they have 6 months cash reserves for operating, but we're at 63% of our current cash reserve to our annual 24 budget. So that's 7-8 months of cash reserves. Just to put it in context, I know Jeff, you and I have dealt with this issue with another board, but so I don't think that it's unreasonable to have 6 to 7 months or 7 to 8 months of cash reserves, and it's reasonable.
Right. Hey, Zach. So we kind of talked about this at the last meeting. So basically, the cash reserve, when we say we have 6 months reserve, we're talking about catastrophic situation where we don't have income coming in for whatever reason, or if we do have income coming in, it's much less than what we thought it would be. This would actually help to supplement to get us back to where we need to be month to month to month, to make sure that we're paying all our bills, all payrolls getting paid, all that stuff. So this is kind of to make sure that we run smoothly for quite a long time before we have to make some huge drastic decision.
Yeah, no, that's fully reasonable. I take that kind of approach in a personal life as well. So I think it's good to have, you know, liquid assets on hand.
Right. Okay.
And I believe that is the end of my report. Daniel?
All right. One of the things that we've started looking at is some new electronic health records software. Patagonia is a vendor that we've looked at. We're going to, with the transition away from providing primary care, will likely be getting rid of Cerner and going with a more public health friendly electronic health records product. One of our health educators recently had a baby, so she's off until July, which has created a little bit of an additional burden on our social worker / health education supervisor. So we'll keep an eye on her, make sure she gets all the help she needs within reason. I talked to you a little bit about the screening and the poor attendance because of severe weather last month at Park Hill South High School. Unfortunately, the school district can't share the password of all the parents in the school district. It is a product they have purchased a license for, so some of us were able to view the documentary. It covers a lot in a short period of time. I don't know if y'all had a chance to look at it, but sometimes it gets a little dry, but it's very informative. Anyway, that was a little disappointing. That was supported with funding through one of our contracts, the Internal Child Health Services contract. But we'll hope for better weather next time. Did anyone have any questions about anything in my reports?
Scroll down.
One event, I forgot to mention the Northline Prevention Conference was held in March. That's held at Flatwoods United Methodist Church. Platte County Health Department is a big supporter of that event. It's well attended. A lot of law enforcement, a lot of school districts are represented there. Beacon Mental Health. It's a great event. We have some very good national speakers that attend. That was a success in March.
Nothing super exciting. I forgot to add this to their board vote. The social committee did throw a baby shower for Rebecca. And if you ever went down the stats good side, cake pops from Sam's Club is the way to go. It went over very well. But yeah, I think we raised close to $300 just in staff donations and gifts for her. So she was very, very appreciative and loved that. Biggest thing in the clinic wise is we continue doing all like our back to school clinics for Park Hill School District and as well as Platte County R3. Total vaccines given at Park Hill was about 461, 106 over Platte County. So 197 students total for the Park Hill School District and 47 total for Platte County R3, which are our best numbers we've had since we've been going to schools these past years. So they really enjoyed it. Everything's going pretty smooth with that. So we're hoping to keep going and continuing getting kids vaccinated before back to school season. So put the ease of let's lessen the burden on the parents and then lessen some of the workload for us come August. Does anyone else have any questions about my reports?
I have a question about the environmental health report, though. Is that your purview, or it's the section before we got to this? If you go back up farther, it's
Yeah, go ahead.
go back, keep going up until it says page 6 on the it's page 13, I guess. Page 13. So I have a question. I was always going to ask this and I never did. So when you do look at the total, you have food inspections, right? And then you have total food inspections. The question I had though is the re-inspections versus inspections. The re-inspection numbers are way lower. So who is the re-inspection? Are those people that are in violation, or is that something that we have to see certain restaurants, whatever, multiple times a year, or what qualifies as a re-inspection, and why are the numbers so low compared to, relatively speaking, I guess?
Re-inspections are required when there's a number of items out of compliance. They will go back and do a re-inspection. So those re-inspections are in addition to their regularly scheduled inspections. So if a restaurant is scheduled to be inspected 3 times a year, they require a re-inspection each time. They'd actually be inspected 6 times a year.
So, but I guess those restaurants they're under watchful eye, or is this kind of a protocol that we do multiple inspections per year for anybody?
So,
yeah, the higher risk food establishments, and by higher risk, usually it's related to how much volume they do and how complicated their menu is. It's not that they're doing anything wrong. It's just that they are serving foods that are more likely to, a little more complicated to prepare.
Right.
So it's more likely that things could go wrong. So they're inspected 3 times a year. And that's if everything is perfect. Now, if we observe a lot of items in non-compliance, we would have to do a re-inspection. And if there's 2 re-inspections required, like if the inspector has to go back twice, we charge $75 for that second re-inspection. Did that make sense? So they're routinely inspected 3 times a year, the high risk establishments. And then if re-inspections are required, that'd be in addition to the 3.
If you have more than 2 or 3 re-inspections, that puts your food license in jeopardy at that point, or what happened?
It could be, yeah. Yeah, we kind of use the re-inspection fee as an incentive to get those items corrected. But if they just continue to to be in non-compliance, then we would seek a closing order.
And so, and I'm sorry, Dan, and I know I've just done this as well previously at other places. So the first thing is every location, every year, we're going to look at how they are classified, you know, high, medium, or low priority. And so like a low priority might be Dr. Chaffee's famous nut mixes. And so there's no cooking, no temperature control. All he's doing is he's buying food from a fruit store and mixing these nuts together. Then we go to Zach's Fabulous Smorgasbord. And he likes his, they throw rolls, they do all kinds of stuff. They have fried catfish and they're making everything from scratch. And there's all kinds of temperature control. Well, we're only going to go see Dr. Chaffee's place once. Zach, we're going to actually go see at a minimum of 3 times. And we are going to go, but each time we go, that's just one inspection. That doesn't, like, I think I understood what you were asking, is that second time we went, the third time we went, considered re-inspections. No, they're just routine first inspections. But we go and we see Zach's stuff and a refrigerator's not working and they can't get that fixed right then. You know, we would mark it corrected on site if they could fix it, but they can't. So we're then going to go back. And that's that first re-inspection. We go back and Dan's like, they still don't have that refrigerator fixed. They need to get it fixed. Now we go to, I won't pick on any board members, but we go to Dustin's famous deli meats and it's just terrible. And they have so many critical vital, and that's no longer the terminology, foundational or whatever it's called now. I like the word critical and I'm old, so I'm going to use that. But he has so many critical violations that actually, that one inspection may be enough to trigger us petitioning to get that place closed. So yes, it can be multiple violations over a period of time, but it can be like really egregious conditions at once. Does that make sense?
Yep.
Dan, is that accurate?
Yeah.
Okay. Like a
Okay,
sewage
very good.
a sewage backup that they aren't, that they're walking through to continue to serve food. And you would think that that would never happen. Dan, has that happened?
It has happened, yeah.
And it's happened to me, so it's not isolated to, like, yeah, people are funny of what they think is okay.
Yeah, I see
And
that
it's
too.
not funny.
It's
but-
not.
No.
Very appetizing.
And then to have the customers sometimes be like, you're closing them down just for that? Oh, yes. Taylor?
All right, so as far as accreditation, so far, we're working on the readiness assessment, which is kind of a review. That's essentially just going through all of the requirements required by the Public Health Accreditation Board, FAB. And so they have the 10 different domains. We have 10 different work groups, one for each domain. And then we have an overall accreditation team. So right now with the readiness assessment, we've completed 6 of the 10 domains, and then we have a few that have already been reviewed. This next week or two, I think myself and Dan and Andrew plan to continue reviewing them. And ideally, we will have that done within the next month or so. So we're kind of we're doing pretty well with that. They recommend around 4 or 5 months. But I think we're going to be able to beat that, and get that done quicker, but we do have a year to complete that. But I mean, I don't think we're gonna need the whole year just for the readiness assessment. Once we have all that done, then we'll move on. They'll give us feedback, kind of tell us what we need to do, and then they'll kind of give us more information, and we'll have to kind of tighten up some other things and do whatever they tell us and give us feedback on. I think we've talked about the local public health agencies incentive funding.
Can you hang on?
Oh, sorry.
One thing I do want to mention, and it's a bullet point in our report. And is that number just since we started, or is that for the month?
Yeah, so that's since we started because I didn't collect it in February. So it was about 2 weeks in February and then the month of March.
So over about 6 weeks, staff spent about 144 staff hours on this readiness assessment, which is in addition to, like, this is all new stuff. It's pretty intensive. And I have a share of those hours. Dan does, Dustin does, Cindy does. But staff all throughout the department have been involved. And one of the things that it's really bringing to light is this is quite a massive undertaking. So right now we're just looking at pretty much every aspect we can of our day-to-day functioning, saying, do we kind of do this best practice is what it's getting at. And unfortunately, the easiest thing right now is to say no. And we have a lot of no's. The hard thing, and it's really about documentation. We do it, but we don't document it. And if you don't document it, it didn't happen. And so many policies, so many things, so much work. And I had asked Taylor to kind of to keep track of how much time we're spending on this, because I will say that at least for me over March, I just felt so swamped with stuff, and we didn't do certain, like, it wasn't like a really horrific month of, knock on wood, anything that was happening out of the ordinary. It was just kind of this taking a front seat on some things. It's going to be great in the future, but it is really time intensive. Kind of surprised, but it's also generating a lot of great ideas. And I don't know if we have buy-in from everybody quite yet, but I do think we are working on, we're getting people involved. And I think when we're all said and done, it won't be the board said you need to do these things this way. It'll be or Dan or Andrew or Dustin or Cindy. It's going to be like they have real say in where we're going. Dan, do you have any impressions about all this work? Because I know a lot of your staff have been involved.
Yeah, and I think it'll be good for us all to go through the strategic planning process too, which is one of the areas where we need to focus on as well coming up. Of course, the board will be very involved in that. But I think it's going to be the better staff, but the more staff buy-in we get, the better the department will be in the long run. So I think it'll be good process to go through.
So this is a lot of like getting processes and best practices in place. So a lot of the work is going to be up front, and then after like this accreditation gets achieved, that kind of thing, and these are reviewed and approved, then it's just maintaining them, right? So it's not like it's going to be ongoing, like just
It's a cycle.
swamping everybody like permanently. This is
Right.
more paying up front for best practice
So-
to be used moving forward.
Right. So really overwhelming up front, and then continuous quality improvement as we go, but more of an ability to pick certain things isolated that we need to work on, or, you know, being informed with our community health assessment, community health improvement plan, and our strategic plan. So being able to put some resources on that, which then Taylor will be able to focus on. But right now it's like a shotgun, everything all at once. It's a little bit daunting, and I just sit in there and I'm like, oh my gosh, we have so much to do.
The accreditation's for 5 years, is that correct?
Mhm.
And the process has to be repeated in 5 years.
Right.
Correct?
But probably like 2 or 3 years before.
Right.
Because there is a few differences between initial accreditation and reaccreditation. So they do add a couple things as you go, like to do. And then they also ask for annual reports. And like Andrew said, they have continuous quality improvement going on. And then they also want you to update certain things that within certain timeframes. So they want like policies, procedures to be updated every year. And so that's also a big thing that's on the next page that we're gonna be talking about. So accreditation, they have certain policies and things that they want you to include. Obviously, we have a lot more than they actually want, but right now we're kind of revamping the policy and procedure thing, trying to make it a little bit more concise, more readable, a little bit more user-friendly. And then also just making sure that everything is written down and that we do have those policies and procedures that are in writing, not just in our heads, just in case if we get a new employee, they can come in, they'll be able to read the policy and procedure, and ideally they should be able to do the work. So we are going to be doing some policy and procedures trainings coming up, and making sure that people know how to format them so they're all done in the same way, and then we'll be putting those into the software system that'll remind us each year to update them.
So we have a pretty comprehensive set of policies and procedures, but they've been written, reviewed, rewritten over the course of decades.
Yeah.
And some of them haven't changed much over decades. Well, what someone wrote in 1989 is really going to be quite different looking from what we wrote last month. And so that Dan Taylor and I spent some time, and I guess to qualify, I said like the accreditation part is taken up a lot of time. Like, yes, I've been in these meetings, but then we're also talking about having other meetings for the policy and procedures and some of the other things. And it's important to us that we get the standardized, so when we go rewrite these, that they all fall into a format that kind of makes sense. We kind of got a really good start on logical approach with the board's bylaws. When we went through that, we looked at a bunch of different places and what things we like. Our policy and procedure won't look exactly like the bylaws, but the logic is going to be there. It's, bulleted, it is concise statements. It's not 14 paragraphs of narrative to get to what we're trying to get at. So Taylor, I'll turn it back to you. Did you have a question, Dr.?
I was just going to be supportive that we continue to monitor the amount of HR resources put into it, just for perspective, because I really love it that this is a really establishing a continuous quality improvement program, but it's also going to be a template that we can share with other health departments and all of the accredited health departments in the state. Hopefully with the Malvo, if that comes to fruition, one could imagine a website with all the accredited health departments and access to the resources of whatever they're willing to share for health departments that don't have as much an HR resource to put into it. We could see what a smaller county 5 years from now goes through with utilizing the resources. When you don't have the resources, it takes 144 hours every 6 weeks. When you do have the resources and the templates and everything else, here's what it took a smaller county to do. I think that's it would be very beneficial. So I'm encouraging that we continue to monitor that for multiple reasons.
Yeah.
Hey, Taylor, I have a question for you.
Okay.
So once all these domains are completed, what actually happens next? Do they do another site visit, or do we just send all the data to them and then they look at it and peruse and then get back to us, or what actually happens?
This is just for the readiness assessment. So the readiness assessment is essentially looking at all of the things that they want us to complete. And then we're going through and saying, do we have this? Yes, no, or there's an in-between where we have maybe parts of it, maybe it's outdated, maybe we have one example, but not two. So right now we're just assessing what we have. And so that's what this is. So once we complete that, we'll turn that into them. They'll give us feedback on that information, and then we will have time to provide documentation. So right now, we really just have to say, do we have this, yes or no? And in the future, we're going to have to provide that documentation. So then we'll start to add in different documents. So some of it's policies and procedures, some of it's examples of things. There's things around communication and risk communication. And then there's the community health assessment, community health improvement plan, the strategic plan, performance management. There's a lot of different pieces. So, that's gonna be,
Yeah.
that's gonna take a while. Yeah, so I mean, at least the community health assessment, community health improvement plan, the township, we already have those and we're already working on the next cycle for that. So some of the things we already have in place and some of them we have a lot of work to do, kind of like Dan mentioned, the strategic plan. But we'll start working.
So really, this is our baseline. And then they'll make us substantiate the things that we say we already are doing. And by the way, you need to now bring up everything you said was a no to a yes before you can get accredited.
Mm.
And what are you estimating timeline? Dan wanted it before he retired.
Yeah.
Dan gonna have to work a little longer.
I said that plus 1 day, just people's.
Yeah, right. My thought is that, so they say that they'll give us feedback within 2 months. So if we can turn it in and they give us feedback, by June, then ideally we'll have like, probably it's gonna be at least a year for the actual documentation and doing some of the things that we need to do. Probably my estimate. And then after that, then they will have a site visit at that point in time. And then they'll give us feedback and they say that can take 6 to 9 months. So it depends, because so they could give us feedback and say, oh, like we didn't like this example, it doesn't cover this measure, so we want you to like give us something else. So they will give us like some feedback throughout. It's not like, oh, you missed this one thing, so we're just gonna say no. It's kind of a process.
Well, we can always form a deputy director emeritus position.
There you go.
That the job is to help make sure we get the accreditation done. But you volunteered.
Yeah, oh, that is.
We're gonna write more policies. Policy writing.
So Dan, you can't actually plan on retiring for at least another 3 more years. Just know that. Sorry about
Yeah.
that. We won't accept everything.
I'll come back and visit.
Well, and I don't know if you know this about Dan.
That's
I
always
find it
nerve-wracking when he
weird,
says that.
and I think weird is the nice term, but he loves writing policies. Like,
Okay.
he just loves doing it. I've never met anyone that was just prolific about, I'll say it and he'll go write it.
It's kind
And
of
it's-
strange. Isn't it?
It is a little unique from what I've experienced.
Isn't it
And
wonderful?
so-
There's people like that out there.
It is. And so he's very excited as we have discussed, getting this template. And he's like, we need to get it done so I can start. And it's awesome to have that enthusiasm, but it's odd.
It is.
And I had to push the pause button. Yeah, wait for a minute.
So talk about the exciting stuff here.
Oh, money.
I like money.
Okay, so, the LPHA incentive funding, we have reached all of the eligible, incentive activities that we can. So that was like 90% of what was offered. The 10% that we weren't able to do is being fully accredited. So we're not able to get to that in the next 12 days. Unfortunately, I know Andrew was hoping that he moved a little bit faster, but yeah, so these are the requirements, that we did reach. And one of those was the Board of Health training that you all attended. So we signed an agreement with GHSS that's been fully executed for $27,439. It's exciting.
So it's not a ton of money,
Yeah.
but some of these things that we did were not super time intensive on our side either. So like my training I took me like an hour. So it wasn't,
But it's one less dollar out of the direct taxpayers of the Platte County.
absolutely.
And it's doing CQI and getting paid by somebody else because they're encouraging it. We're just doing what we wanted to do anyway and finding ways to fund it.
Absolutely.
I know I restate the obvious, but it's obvious to me. I hope it is to everybody else.
So then myself and Dustin have been attending the Emerging Leaders Academy through KU's public management program. It's a leadership and professional development training. I also attended the new accreditation coordinator training, which is another required thing that requires for accreditation. And like I mentioned, been working on updating the policies and procedures, and we're going to be having a training soon once we finalize that template format. I think last month we talked a little bit about the BMSG performance management software. So we have that in full motion. We started trainings for that. And so we'll be doing a few more trainings for that with staff and management. And that is the software also that I was talking about that we'll be using for the policies and procedures. And it will help us like internally keep track of where we are with different tasks all throughout the health department. It also helps keep track of where we are with accreditation. And then it will also help us keep track of those policies and procedures. And it will kind of remind us to update those annually because I know that, like Andrew said, sometimes it gets those policies and procedures get written and then they get put on a shelf. But this will help to remind us to check those.
And at the board level, I think last month we even discussed it, and Kim had talked about, I believe it was the bylaws and even the annual report, we changed some things in the bylaws so that we are looking at this stuff every year. And it just really does help us keep 12 months actually. Sometimes in some ways it seems like a really long time. And then in other ways, weren't we just electing board officers or weren't we just doing this? And so it really does, that time can get away from you really quickly. And so just having some kind of markers that say, we need to just take a quick look at this or whatever. And I was kind of shocked for our bylaws even. We just passed that in November and we didn't have a major rewrite, but we had some significant changes in like 4 months. So I think it's a good process to, go through. So thanks, Taylor.
And then there's the communicable disease and any reports.
Can you scroll down slowly on that? I know I glanced at it, but with what Dr. Kingsley brought up, we have our COVID-19 in here, correct?
Right.
And flu's on there?
Mm-hmm.
Okay. So the data that is being collected will still be available to board members here.
Right.
In perpetuity. Because it's a communicable disease that's reported.
Right.
How long do they want to keep getting information on COVID-19 though? What is the time frame that they're looking at?
It's added to the reportable disease list
until they take it off the reportable disease list.
And I don't really see that happening, but we all know that the testing is not occurring.
No.
Jeff, I think it's probably going to be taken off reportable diseases, just like flu is not a reportable disease, but the state has a surveillance program in place.
Right.
I would guess it's going to move to more of a surveillance program at some point.
That makes sense. Yeah.
And even like the CDC new respiratory virus protocol, you can tell it's headed that way.
Right. Well, the funny thing is that it's not really COVID-19 anymore, right? I think I've said this before. It's
Right.
like the great grandson and the great grandnephew of COVID-19.
One of the benefits is it mutates so fast, it's going to mutate itself out of existence.
Yeah.
Right. So actually, as COVID-19, it's not around anymore. It's whatever children's of it.
Cindy. Susan, have any report?
I don't. We did not meet. I just got home from the hospital, so.
Are you feeling better, Susan? I haven't heard you coughing or anything. So
Yeah, night and day. Night and day,
Okay.
so.
Excellent.
So we decided to cancel the meeting and we will meet in a couple of weeks.
Yeah, and we'll pick up.
Yes.
Do you know what day it is? So I put it in my calendar.
Cindy, do you know what day it is off the top of your head?
I don't either.
You'll send out notice, right?
Send out a notice.
All right, don't worry about it then. Okay, that's fine.
Yeah, their motions.
Okay, I make sure I'm not having a
No,
stroke.
you're good. I could run back there.
You know, you're old when you're worried about it. Does that really happen?
May 14th.
So, Dr. Kingsley, May 14th at 10:30.
May 14th, 10:30.
And it should be on his calendar, right, on his PCHD calendar. It's on yours.
Okay, that's fine.
So the next thing, just really need to review and approve the bills.
And there was a correction, I think, that you
Yes.
handed me. Yes,
Yeah.
different explanation of bills on 3 different checks. Do I need to outline them or?
You know, not really, it's
Okay.
all, I mean, if you want to talk about them, because I don't think everyone.
As long as the revisions are archived in the final minutes.
Yes,
Yeah, they will be.
and the checks are correct.
I'm
Yes,
just glad we have processes to catch that.
You know, we finalized the board packets on Monday, and then we'll have bills come in. And in the state statute, and I'm sorry if I'm repeating all this for you all, I'm
yes,
kind of telling you as we go, Zach, some of this, but the board is responsible for approving every expenditure that the health department makes. Now, on a day-to-day basis, the process, you know, that falls to me and the staff, and we have all kinds of, you know, everything has like 3 sets of eyes at minimum before it ever gets to the board. But the board is the only one who can actually approve these expenditures of taxpayer funds. So we are looking at that, but on Monday, we finalize the board packet, and then we'll get a bill. And it's that, because of how the month falls, it's that monthly bill. And if we don't get it on for tonight, it's not going to get paid in time. So that's why we end up having some things that are last minute, but for the most part, it's always routine. Any new kind of big expenditures, we are going to come to the board and get approval first. So a lot of this is routine or it's already been approved.
That's good.
Any question about that, Dr. Shelby? So just need a motion to approve the.
I move that we pay the bill.
Second. Okay, any further discussion, anybody? Okay, let's all vote. I'm an aye. Mike,
Yes.
Susan,
Susan, I,
Kim,
Yes.
Zach?
Zach, yeah.
Okay. It's a done deal.
Fee resolutions.
There isn't one.
Oh, yay.
No changes.
We like those nights. NPR insurance rates. Scroll down because I can't remember. So this is the second year in the row that our insurance rates have stayed the same. So we need no board action on this, but this is our health insurance, our vision, our dental for our employees. Pretty exciting news for me from where I've historically come from. We didn't have year to year no increases, so that's pretty exciting.
I have a question. Are we locked in to like a long-term deal, or are we year to year kind of thing? How are we doing this?
Cindy, how often do we sign the agreement?
Once a year
Yeah, it's once a year.
in May. Or it's back in July.
yeah, this is July 24 to June 25.
Do the insurance companies, are they willing to do long-term contracts? Is that something that they've brought up before or no?
So we currently use Midwest Public Risk, which is a government risk pool. So it is basically a conglomeration of a whole bunch of small local governments. And what we decided was how many? Like 5,000?
Yeah.
So it represents like 5,000 employees. So we can, but we don't actually put it out for bid for the HSA administrator or the insurance providers. It's actually Midwest Public Risk who goes out and does that. So we are signing a contract with the government risk pool, and then they're going out and now with their 5,000 employees, able to get way better rates than we would be with our 40 employees.
Yes.
So the other board that Dr. Chefe and I are on, the employee insurance remain pretty stable, but all other types of insurance have gone through the roof. That's why any kind of way of locking things in long term, right about this is a horrible time to be buying insurance. I tell you that. Although the employee health insurance stuff has been very stable, so that's kind of nice. But everything else is not.
Yeah, it's been difficult, you know, when I think the biggest increase we've had as far as any type of liability insurance has been our cyber insurance that we had talked about, because that's kind of blown up because it can be a real big liability in multiple ways.
And Jeff, one of the reasons that we probably aren't seeing the building insurance increase is the building insurance was established when the renovation was done. So they would have based that upon actuarial data that was real time and true cost to build. They have those real numbers because it's the true cost to renovate the building.
Right.
So it's not going to be, you know, we didn't go from $220 per square foot to $265. It's established now, which is why I don't think we're seeing that effect here.
Okay.
Then the next thing I wanted to talk about, and this is something Dr. Kingsley and I have talked about, and I'm not sure that the entire board is familiar with the Northland Health Alliance, but the Northland Health Alliance is basically an organization for healthcare providers in the Northland. It's largely made of the hospitals and the health departments. Do you have examples of others?
Beacon
Mental Health. We used to be Tri-County Mental Health. So they just hired an executive director, and she is trying to get more membership from medical clinics and different places. But on the 30th of May, they are having a prospective member mixer. And so Dr. Kingsley, I get to be his +1. So the get to go, and Dr. Kingsley's going. But it's not really anything other than just to meet different people. And I thought it might be good for Dr. Kingsley to meet some of the other members and prospective members.
That's good. So from what you told me, we're basically already members. We're there to help recruit new members. So we're there on a mission, is what you told me.
Any questions about that? You can go ahead and scroll down. And I will let you talk about this one.
All right. So the last item on the agenda is the state investment in local public health services contract with the Department of Health and Senior Services. This is a contract we've had for many, many years. They used to call it the core functions contract, but the Department of Health pays us to provide certain public health services in our county. They're listed there: the chronic disease control and prevention, community health and wellness promotion, and so on, including environmental public health activities, public health emergency events. But the contract is a 3-year period, and the contract amount is increasing to $102,451 per year. They pay us an equal monthly sum throughout the year. Previously, the amount was, I think, $92,000 and change. So it's our monthly income is going, our revenue from this contract is going from $7,600 a month to $8,537 a month. So staff's recommendation is that the board authorize. It's actually a 2-part recommendation for motion language. First of all, recommended the board authorize the director to sign the memorandum of understanding with the Department of Health and Senior Services, and then to authorize the director to sign the participation agreement for the state investment. There's two different kind of pools that the money comes from. But one pool is the CHIP, Children's Health Insurance Program, Health Services Initiative, and then the other comes from the state, their general fund, the DHSS general fund.
Zach, you wanna ask questions or proceed?
Just read it.
Yeah, so I'd like to move to authorize the director to sign the memorandum of understanding with DHSS regarding CHIP HSI for the contract period of June 1st, 2024 through May 31st, 2027.
We have a second.
I'll second that.
Okay, any further discussion?
I
Okay.
just have one thing to say real quick, because Dr. Chate and I were exchanging a glance at each other. And the thing I want to say is, you see that whole list of like really good public health things that the public health department should be doing. And you see how much they're giving us. It doesn't cover, I mean, if it weren't for the citizens of Platte County, we would not have a functional health
I was
department.
gonna say, yeah.
Spend a dollar per person.
Yeah. I was just about-
It is nowhere near enough to provide the public health services that we provide, or in the, with the resources that we provide them. And that is the same across the state. I worked at a place that did not have a mill tax, and we had 13 people to serve about the same population. And the services those citizens got were,
A good topic of conversation from Malibu to
Yeah.
tackle and to provide assistance to smaller counties on the benefits of a mill tax that could be demonstrated by a mill tax like in Platte County. So not to digress, but we can vote.
but sorry, I just wanted to make
Kick
sure
that around.
those numbers that you saw, it wasn't like some. Now, the contract does authorize us to do a lot of things and have access to a lot of health information systems and different things. So the contract, it does give us some money, but probably more important, it makes us a health department with all the rights to be a health department. in Missouri.
Okay, any further discussion? Okay, since Zach made the first motion, Zach, yes or no?
Yes.
Mike Chaffee, yes.
Chaffee's yes, Susan, yes, Kim,
Yes.
and then me, yes too. All right, who wants to do the second one?
Go ahead. Kill it, man.
All right. I move to authorize the director to sign the participation agreement for state investment in local public health services for the contract period of June 1st, 2024 through May 31st, 2027.
Do we have a second?
Second.
Okay, any further discussion? No,
Vote.
okay, Zach,
Yes.
Mike,
Yes.
Susan,
Yes.
Kim,
Yes.
me, yes.
And that's all our new business. Dr.
Actually, we
King.
do have one more new business. Dr. Chaffee had asked me if he could ask a question about the avian flu and have a little section for it. So I guess this is the spot if we could do that. Do you have anything you want to bring up and talk about, Mike?
I did, I'll bring it up now just for the record, but I'll be brief and I don't want it to take any time from us, but I was looking back in my notes and I had March 21st, I'd put in that I was interested in looking at the strategic planning for preparedness of avian flu and disaster coordination and planning. In the last month, just for the records, we have gotten a second mammal to human transmission in Texas from dairy cattle. Part of our duty is to anticipate and protect. So I will be communicating with the director and deputy director outside of the meeting to try to prompt and figure out if there are steps that are disaster management or pandemic planning coordinator, strategic planning, or whoever's in charge of that, and kind of scratch our heads. Are there things we ought to be anticipating and looking at? Because I think it's not a matter of if we do have an avian flu issue, it's a matter of when. And the reason I say that is it's going to take the human to human transmission to become a serious problem. I'd rather us consider what Platte County's options are and how best to be prepared in advance of that problem happening. I'm not suggesting we all go have everybody get H5N1 vaccinations, which are available, but what are the things we can do given what we went through with COVID to best be prepared reasonably should we run into something like that. And I brought it up before the meeting. I forgot I told Jeff I just wanted to bring it up, but it's something I think that as a director, I think it's in the best interest of this department to start to look at that and not ignore some of the things that are going on with a potential devastating pandemic.
So I know some work on that has already been done. Taylor, I'd ask that you get with Aaron and just kind of, we'll get this on the agenda for next month and we'll actually have some things to talk about. I'm like,
It's my
off the
duty.
top of my head.
Yeah, I'm not worried about it. My duty as a board of trustee is to bring this up, to bring it to your all's attention and ask what your suggestions are in this matter.
Yeah, we'll have a brief presentation on what's already being done and what we will be doing. But I know there's already work on this.
I'm sure there is. I'm just fulfilling my duty to ask the question.
It's extremely rare for avian flu to hit the human population, but when it does, it can be pretty deadly. It's for people that have significant comorbidities. Like the flu vaccines that we give do not cover H5N1, right? Like Dr. Chaffee was saying, there is a vaccine for it, but it's not the one that's in general population use. So it's good to be on top of it.
A 50% mortality rate for the 889 people they've listed have been documented as human cases.
Right.
So 50% mortality. Now, those folks may have serious comorbidities. They may be in countries where their health is not as good as other countries. But having said all that, I see this. I have a duty. We're executing it. Thank you guys for the time on this.
Oh, perfect.
Right. Perfect. Okay. Do we have anything in closed door session or anything, or are we just pretty much it?
That's it.
That's it. Okay. Our next meeting will be May 16th, 2024 at 6 p.m. Do we have a motion to close the meeting?
I move to close the meeting.
Do we have a second? Any further discussion? Okay, Zach.
Yes.
All right, Susan.
Yes.
Kim.
Yes.
Mike.
Yes.
And me, yes. Very good, guys. Awesome work.
Thank you all. Bye, Dr. Kingsley.
Bye, everybody.
Bye.
Recording.